we're frequently asked for data and evidence on kind of access to justice issues, from the demographics of frontline users to the number of services people access before they resolve their issues. So the purpose of this session is to kind of shine a light on the challenges, opportunities and existing initiatives that are part of data collection in the sector. Again, if there are any questions, please do pop them into the chat and we'll make sure to follow up. Because we're so short on time, I'm going to ask our wonderful speakers not to use this time to present a PowerPoint, but just to kind of give us a general overview about what they're doing. But that said, any PowerPoints that are being created, we will gladly share across the community as part of the notes to this meeting. David Hawkes is going to be talking about Advice Pro and how it works as a data collection tool, what data they're collecting, trends they're seeing. Alex Charles and Emily McLeod from LCN will be talking about their data collection project and what they've learned and how it's helped reshape and refocus their thinking in certain areas. James and Claire will be talking about the LawWorks Clinics Network kind of annual report and their data collection exercise, and Carrie will be talking about the National Helplines data. And then Jane will be talking about the community legal outreach collaboration and type of trends they're seeing. And Sasan and Ildefons will be talking about the legal support for litigant in-person grants program, some of the challenges and opportunities cross-sector organizational data collection provides. There we go. So I'm going to start with the data collection piece. So I think first, if I could kind of group together David, Claire, James and Jane. And I'll start with you, David, if you could just give us a really kind of brief overview to what Advice Pro is, what it does, how it collects data and what data you can collect.
Okay, thanks, Martha, and hello, everybody. So yeah, I mean, at Advice UK, we have three main data sources. We use Salesforce, our CRM, which really captures all our interactions with our members and stakeholders. We use an online evidence survey, which is a bit like the old Citizens Advice Bureau evidence form, which is where advisors can submit actual case studies. And then we use the group reporting functionality on Advice Pro, and that's what Martha's asked me to speak about briefly. So for those who don't know, Advice Pro is a secure case management application. It's a partnership between Advice UK and ACM Solutions, based up in Edinburgh. At the time of speaking, it has over 9,000 users, and it's used by 580 organisations. 371 of those are members of Advice UK, but users also include housing associations, local authorities, and universities. It's actually grown significantly in recent years, and that growth has continued throughout COVID-19, when I think it's actually been incredibly invaluable to organisations, particularly those working remotely. So in terms of the data, in a way, I guess there's two types of data. There's demographic stuff, so it's client, personal and socioeconomic data, and then it's actual casework information. Now at Advice UK, we have access to a group reporting functionality, so that's anonymized data, but it enables us to actually look at the demographics, but also the types of inquiries and cases that advice agencies are dealing with. So I can do high-level reports, and I've been doing a monthly report since early last year, just looking in very broad terms what's happening in terms of case volumes by area of social welfare law month by month. And so that will hardly surprise anybody to show that from April last year, we saw a significant drop in volumes, but with two exceptions. So we saw a spike in employment law cases, and we saw a spike in domestic violence, and that's continued, I'm sorry to say, through, since March last year. And then we've gradually seen a recovery, so that in some cases volumes are now running higher than they were pre-pandemic. But so anyway, so that's how we can just keep it's a very high level thing. But then we can also do very detailed investigation. And I thought a good example is that we had funding, or our members in Scotland got funding from the Scottish Government last year, to actually look at improving access to debt advice and improving digital access. So we were, the members who were involved, it was about 30 of our Scottish members who actually received this funding. And we were able to create really detailed tailored reports, actually analysing the work that had actually been done as a result of that funding. So we could do things like look at the geographic spread of clients, and we could produce lovely maps showing that. We could look in detail at the priority groups that the Scottish Government had identified that they wanted to support, so lone parents, ethnic minority families, and so on. It had a debt focus, so we were able to look at the different types of debt, the amounts of debt. We were able to look at the reasons for debt. We were able to look at the type of advice that was actually being sought. We were able to obviously look at financial gains and outcomes, but also non-financial outcomes as well. So it was extraordinarily rich. It was actually data that the Scottish Government has found incredibly useful and has already used for a number of other purposes. So I think the big strength with Advice Pro is the richness and the extent of the data. Another strength, which is also a bit of a weakness, is that it's incredibly flexible. So, the different subscribers can actually customize it to meet their needs, the needs of their client group, and the needs of their funders. So that's a real positive. But what it does mean is, of course, that the data isn't always, it's not collected consistently across all the subscriber agencies. So if you want to get into really detailed stuff, then it usually has to be where you have to collect specific data by request, really, or do tailored reporting, perhaps based upon a particular funder's needs. And the Scottish Government provides a good example of that. So that's a quick run through. I'll put a link to Advice Pro in the chat.
Thank you so much. That's perfect. And one last question from me. Are you able to share some of these data sets that you're talking about, particularly?
I can very easily and very happily share the broad level reports that I mentioned. And actually, I certainly have shared that elsewhere. So yeah, I'll be very happy to do that. I'll send it to you separately, Martha, and then you can circulate that.
Wonderful. And James and Claire, could you talk a little bit about kind of your data collection with the LawWorks Clinics Network?
Yeah, I'll start off. So the LawWorks Clinics Network, we have 306 clinics currently registered on the network, and those clinics are hosted and run by a variety of different organisations, law schools, advice agencies, community organisations, and some law firms. So it's a very diverse ecology of clinics, and so the clinics essentially they are. Clinic is just a kind of expression for the organisation of free legal advice sessions offered by legal professionals, and it's a variety of different types of models and delivery structures for those clinics. But we register clinics to our network and provide support for those clinics, and all we ask for in return is that they provide us annually with data over the calendar year. So we retrospectively collect data from the previous calendar year. We send out a kind of click tool survey function at the beginning of the calendar year to collect all data for the previous calendar year, and we prep the clinics across the year to be able to do that and provide tools and spreadsheets and kind of guidance on what data we're looking for. But it's only really the most base elementary data that we collect, which is overall number of inquiries the clinic has seen, the overall number of those inquiries that led to advice, people getting advice, or a portion who have been signposted or given live information, and then the portion that of clients that clinics haven't been able to help. We break it down by region, areas of law. We ask some overall questions about number of volunteers in clinics, and we ask some basic data about the demographic profile of clients, so that we have some basic qualities data. So that's, and then we then publish the findings annually in an annual clinics report. We publish that now mid-year in June, July. So I'm going to pop in the clinics report from last year. So Claire's put it in there, that's great. We're currently working on our report for this year. Now, last year we saw around a total of 77,000 inquiries, and this year it's dropped quite significantly, but that's partly a function of a lot of clinics either not being operational over some of the period of COVID, and some of the problems of transferring to remote delivery, and so data capture problems there, and so some data we know is not necessarily being captured, and then also the problem we've all discussed about the disappeared clients of disengaged in services. So due to that, there has been a drop, and looks like around we've recorded around 50,000 inquiries at clinics over 2020 compared to the 77,000 over 2019, which is probably not unexpected drop in all, given that they haven't had the same operational capacity in clinics across the network as pre-COVID. But Claire, what's our latest data on clinic operational capacity?
About 75%, so 229 clinics out of 306 at the moment. And that's where some services have amalgamated. That's where some services were once in a village hall and don't have the availability to hop online and buy laptops, etc. But that is also encompassing clinics who have sprung up in the last year, because it has meant that they can offer an online service or a digital service that, or telephone service that will allow them to operate with volunteers from all over the country, for example. So it has shifted the way that clinics are moving, but we are acutely aware that it's not the way it used to be, and we're working with that network of clinics to get them either operating back face-to-face, some sort of form of hybrid model, trying to plan for risk assessments in returning to physical spaces, trying to combine the two and work out appointments that are best suited for clients' needs and best suited for volunteer needs. And so we've been surveying and supporting clinics to survey their volunteers and clients to work that out as well. So an informal ad hoc piece of data monitoring and analysis that's gone on in the last month, just to try and form some evidence to get clinics better informed of what their service users need and what their volunteers are willing to do in the coming months.
And Claire, will your survey still include the clinics that have been closed or have had to close by their experience?
Yeah, so in the last year, obviously, as James said, the data reporting for 2020 comes from January to December 2020. We had 3 months of that year where there was possible of normal operation and data collection, although some clinics have said we just haven't been able to get access to our paperwork for that time frame. And even where clinics have been closed, we did include some new survey questions at the back of the survey, some more qualitative information that we're collecting around about how has COVID impacted on your service? Have you been able to operate? Have you found that your geographical boundaries have changed? Have you found your different client groups have changed? So a lot of that information is also coming from services that, yes, were operating and were open and have transitioned into a remote service, but they're also covering clinics that now haven't been operating and have also been closed. So we've got the two sides of that. So hopefully quite a diverse and widespread of information that is being crunched at the moment in time for our conference launch of our 2020 clinics published date, as it were. So yeah,
wonderful, and we'll share links to that as well.